Patients are often required to have EKG to know how their heart functions, to study the electrical activity that goes on in their heart. Last time we discussed about hemodynamics. Today we will go into the basics of EKG, how to read EKG. We are aware that heart has the quality of automaticity, that is, the ability to contract using its own conduction system without relying on the nervous system. We have the sinoatrial node, which is located in the right atrium. This is where the impulse or impulses start from. We also have the AV node, atrioventricular node. In AV node, there is delay of impulses to allow the ventricles to fill with blood. So AV node acts as a brake or as a soft pedal for the ventricles to be filled with content. Then we also have the bundle of ears, which is located in the ventricular septum, and this terminates to give branches known as Purkinje fibers. These Purkinje fibers are what give ventricles that strength to contract effectively. Now let's talk about EKG waveforms. A complete cardiac cycle means that there is P wave, QRS complex, and T wave. So a complete cardiac cycle must have P wave followed by QRS complex and followed by T wave. So the waveform, the P wave, QRS complex and T wave is described as a family in a marriage institution. The P wave represents a man of the house. He was created first and is followed by a woman, which is QRS complex. So the union of P wave and QRS complex gives birth to a child known as T wave. So these members of the family must always be together. Any separation among them can affect their marriage. So any separation in the waveform, for instance, if P is too distant from QRS complex or QRS complex is too distant from T wave, that causes abnormal rhythm in the heart. So now let's describe the element of EKG waveform. The P wave is when the arteria are contracting, that is arterial depolarization. This contraction of the arteria is brought by the SA node generation of impulse. That is, when SA node generates impulse, initiates impulse, that gives the arteria, right and left arteria, to contract. We also have the PR interval. PR interval begins from the beginning of P wave and ends at the beginning of QRS complex. and the normal PR interval is between 0.12 is between 0.12 and 0.26. We also have the QRS complex. QRS complex represents ventricular depolarization. That is when the ventricles are contracting. So during this period, the AV node has already sent electrical impulses to the bundle of E's. The bundle of E's has also sent electrical impulses to the Purkinje fibers to allow for ventricular contraction. So during this ventricular contraction, the arteria are relaxing. That is arterial repolarization. So in QRS complex, the ventricles are contracting and the arteria are relaxing. So the normal QRS complex should be equal to or less than 0.11 second. So QT interval is another thing to consider. It is measured from the beginning of QRS complex to the end of T wave. QT interval is very, very important to monitor, especially in patients who are prone to having prolonged QT intervals. So the normal QT interval is between 0.32 and 0.44 seconds. It is usually prolonged, that is, QT interval is usually prolonged when the heart rate slows. And QT interval can be prolonged in cases where patients are taking some medications such as the benzodiazepines, antiemetics. So there are some medications that can prolong QT interval. So when patients are on these medications, they should be monitored closely for for prolonged QT intervals, because prolonged QT intervals can lead to torsade points, a form of VTAC, ventricular tachycardia. So we don't want patients to develop torsade points or ventricular tachycardia. Tachycardia, VTAC, can lead to VFib, ventricular fibrillation. So we don't want our patients to develop these complications. So that is why it is necessary for patients to be monitored for the prolonged QT interval. So the normal QT interval should be less than 0.44 seconds. So let's now discuss about measurement of waveform. How did we arrive at those measurements? We said that a PR interval should be between 0.12 second and 0.20 second. The QRS complex should be, less than 0.11 second. And we also say that the QT interval is between 0.32 second and 0.44 seconds. So how did we arrive at those figures? Now, there are thousands of boxes in an EKG graph, 0.12 and 0.20. So in this reading, the PR interval is slightly above the normal. So let's now discuss about measurement of waveform. How did we arrive at those measurements? We said that a PR interval should be between 0.12 second and 0.20 second. The QRS complex should be, less than 0.11 second. And we also say that the QT interval is between 0.32 second and 0.44 seconds. So how did we arrive at those figures? Now, there are thousands of boxes in an EKG graph. You can see that each small boxes, there are groups of small boxes in a big box. So each small box is 0.04 seconds. And in a big box, there are 20 small boxes in a big box. So the big box is 0.20 seconds. So to make it simpler, each small box is what we are going to use as a scale of measurement. Each small box is 0.04 seconds. Now, let's look at the PR interval. For instance, the PR interval, look at the PR interval. So, in this EKG graph, the PR interval spans across 6 small boxes. 6 small boxes. And we said that each small box is 0.04 seconds. So now we multiply the number of boxes that the PR interval occupies. So that means that 0.04 second times 6 boxes, and that translates to 0.24 second. So in this graph, our PR interval is 0.24 second. Don't forget that the normal should be between 0.12 and 0.20. So in this reading, the PR interval is slightly above the normal. So we use the same method to calculate the QRS complex. In this EKG graph, the QRS complex occupies 3 small boxes, and each small box is 0.04 second. So 0.04 second times 3, that equals 0.12 second. And don't forget that the normal QRS complex should be less than 0.11 second. So in this EKG graph, the QRS complex is a little bit above the normal. Now, the QT interval that we talked about, the QT interval should be less than 0.44 second. So in this graph, how many boxes does QT interval occupy? We have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10 small boxes. That means we multiply the number of boxes times 0.04 second, and that equals 0.44 seconds. Like we said, that the normal QT interval should be less than 0.44. So this is normal. This is normal. So when it is extremely above normal, that calls for concern. So let's talk about isometric lines. Isometric lines are lines that adjoin P wave to QRS complex and QRS complex to T wave. These isometric lines are very, very important, especially when it comes to ST segment. ST segment is a segment between the end of QRS complex and the beginning of T wave. So the deviation of the isometric line at the ST segment is very important and is a definition of whether a patient is having ST elevation or ST depression, which may indicate that the heart is having some kind of injuries. So the isometric lines before QRS complex represent the PR segment, and after QRS complex, the isometric line is called ST segment. So the PR segment is a yardstick to know whether ST segment is depressing or elevating. The PR segment, that is the isometric line before the QRS complex, and isometric line after the QRS complex, that is the ST segment, must equalize, must be at the same level. So when you are measuring ST segment and you see that the isometric line of the ST segment is not in line with the PR segment, that means there is an abnormality of the ST segment, which can either be elevation or depression. When ST segment is above the PR segment or is above the isometric line before QRS complex, that is ST elevation. And ST elevation indicates myocardial injury, which is an emergency. And when you see the ST segment or isometric line after QRS complex depressing or falls below the line of PR segment, that is ST depression, and this may indicate myocardial ischemia.